Hi everyone.
Hi.
Today I'm gonna teach you how to perform CPR. And what I'm basically gonna talk about is, first, what is CPR? The things you need to check before, during, and after before performing CPR. Performing CPR, what I mean is step by step what you need to do and what you need to check. And I'm going to talk about the safety measures, what you need to have. For example, using gloves. Well, let's start. First, what is CPR? CPR is nothing more than breath ventilation plus chest compressions. CPR means cardiopulmonary resuscitation. It is used to save lives if done properly. Things you need to check before CPR. Let's say there's an unconscious person lying on the ground. You are already trained to do CPR. What are you going to do? Well, first you need to think of the safety measures. For example, you need to check if there's immediate danger for you, for the rescuer or the casualty. You need to check that before. Your safety is first. Then you need to have a good protection. In this case, I'm going to use gloves, and you have to have at least an oxygen mask. Okay? Well, what am I going to do? First, you need to kneel alongside the casualty on his or her right side. Then I'm going to check for response. I'm going to touch the casualty's shoulder on both sides, and I'm going to ask him or her if he is okay. Sir, you listen? Are you okay? If the casualty is not responding, you need to make a reassessment. You need to check first pulse. You can check the pulse both in the neck or in his breast. If you feel no pulse, you must check the breathing. You must listen, feel, and look the breathing. For that, you need to put your ear in the mouth of the casualty. You have to be like this. You need to hear the breathing. You need to look the chest, and you need to listen if you can hear any air coming from the mouth. Okay? Well, for that I need to open the casualty's mouth. To make a free airway, breathe airway. So I need to elevate his or her chin like that. Thank you. Like that. That is the position he needs to be. Okay? Well, performing CPR. As I told you before, we need to check if the person has pulse. Is the person breathing? Okay. If the person doesn't respond, is unconscious, and is not breathing, then we need to perform CPR. How are we going to do this? Well, first, we're going to kneel alongside the casualty's right side, and then with your dominant hand, you will place your knee 2 centimeters below the sternum. The sternum is this part of the bone that is in the rib cage. You need to place both fingers to feel, and 2 centimeters below the sternum, you need to place your heel. On top of your on top of this hand, you need to place the heel of the other hand, and then you need to interlock your fingers like this. After you do this, you need to make a compression. The international protocol indicates that we need to have 30 compressions with 2 breathings 5 times. What does this mean? I need to be doing 30 compressions with 2 breathings, that 5 times. After those cycles, I need to check, I need to reassess my patient, and I need to check the pulse, the breathing, and his consciousness, especially his consciousness. Okay? How am I going to do the breathing assessment, the breathing help? Well, for this, I need to use one of these. There are different kinds. Some of them, they're just a plastic bag. This is an oxygen mask. For this, I'm gonna put the oxygen mask, and when I finish my 30 compressions, then I will put my mouth here, and I will assist him or her with breathing. Okay, what happens if the patient or the casualty is breathing? Well, for that, we need to put him or her in the recovery position. We need to put the arm here, and we need to put him like this. Okay? That's only if the person is breathing. I'm sorry, one step I forgot is that as soon as you see a person, call for help. You see a person, sir, are you okay? You're listening to me. Call 911 and you return here to help me. Okay? That is one of the most important things you need to remember. Okay. If the person is not breathing, you will do the CPR. After you perform CPR, and if the EMS, which means emergency medical service, I mean the ambulance, doesn't arrive, you need to keep going with CPR. If you keep doing CPR and the person has pulse or is breathing, it's fine. But you need to keep doing CPR just to help the heart. Okay? Well, after that, you need to be very careful that even though there is no response of the casualty, even if you keep doing CPR after at least 20 cycles or 15 cycles, if the patient is not responding, well, he's probably dead. That's it. So, it's pretty, that's it.
Did you stop?